Now let's go to the next thing, permeable gut. What we get with here, what we're talking about is that you have a lining of the small intestine, okay? They're like little finger-like projections. The food goes down around it, and when it goes in through this lining, and it goes into the bloodstream, it's taken to the body to the liver, and from there it's processed and you make energy and all the different things you got to do, the vitamins, the minerals, the proteins, carbohydrates, fats, all that kind of stuff. If that lining gets too thin, too large of particles of food can get through. If they do that, they can produce, the body will treat them like they're an invading organism and will produce antibodies. What you get from that is an allergy reaction. So that's one of the first places your allergies start to occur. First of all, you don't break down the food small enough, then you've got a thin bowel lining, so you've got a leaky or permeable gut, so those bigger food particles can get in. Now, pollen's the same thing. Animal dander is the same thing. You inhale it, it gets stuck in the mucus, you swallow it. It goes through your digestive tract, just like food rot. Nobody goes around eating their cat dander. Nobody goes, oh no, anyway. Nobody goes around, necessarily trying to chew on, ragweed or something like that. You breathe these things, they go into your system, just as though you ate them, okay? And if you've got poor digestion and or a leaky gut, you have a much greater potential for developing an allergy. And that's where we get a lot. So it all starts in the gut. Remember, too, the bulk of your immune system, which we're going to talk about in a minute, is in the digestive system. It has to be. This is where all the nasty stuff gets into your body once you get it cut and goes through your skin directly. But it doesn't get through the lungs very easily. It can get through the GI tract, so you have to have lots of immune activity in your gut. If your immune system is weak, other critters can get through and start to cause problems for you. Okay? So that's why that's important. So permeable gut. Now there are actually tests we can do. The secretory IgA, S-I-G-A test. It's a saliva test. It's not expensive. And it'll tell us how much of that particular material, that immunoglobulin that you're making, which will tell us indirectly how thick that bowel lining is, because a thick bowel lining makes lots. Thin bowel linings don't make much. So you can actually measure that. A lot of times when we do that test, we'll also test three of the major foods that people get allergic to: gluten, from the grains, dairy, and also eggs. Sometimes soy as well too. Those four we'll check and we'll see if you actually developed antibodies, and it'll show up in the saliva to that, so we can tell if you already got a problem. Okay. But if you have a thin bowel, you have a low SIGA, you know you got a problem, or at least you can develop one if you don't get it fixed. We can thicken the bowel lining through nutritional therapy, but it takes some time to do that. Because it takes time for it to get thin. You don't just rebuild. It's like bodybuilding. You don't start out built like me and turn Arnold Schwarzenegger overnight. Okay? It takes a lot of work and a lot of time. So it's the same thing with building the healthy gut line. It takes some time to do that. Okay? But it can be done. Once you do that, you don't leak anymore. So you're not going to get allergic to new things that are coming into your system. You still have the antibodies from the old stuff. We're going to tell you how we deal with those in just a minute. Okay? So, the gut has to be repaired. This is done nutritionally and with herbs and nutrients and things like that. You actually try to regrow it just like you would any other tissue that's been damaged. Okay? And of course, if you've got good digestion, it means you're going to have smaller particles anyway, which the body can handle and doesn't react to that anymore. All right? Now let's go to the weak immune function. Like it says here, allergy is a hyperimmune response. In other words, you're reacting abnormally, overreacting to normal substances. You shouldn't be allergic to food that normally sustains a human being. You should not be allergic to things that just grow in the wild. That's not normal. It happens all the time now, doesn't it? There's allergic to juniper, right now ragweed, elm, who knows what else. The cat, the dog, whatever, okay? Cockroach stuff, that kind of gross, but a lot of folks are allergic to, dust mites and all this kind of thing can bother people. So the body should be able to tolerate that. It shouldn't have a problem with it causing an allergic response, which results in a histamine reaction. That's why you get all these symptoms. Now keep in mind too, almost any symptom you can think of can be caused by allergy. And a lot of times you will have health problems that you would never think were allergic caused, but they are. And so that's why it can make it kind of difficult to pick up. Emotional problems, mental problems, physical problems can all be due to allergy. All right, and so that sometimes has to be evaluated, because other things we may do we think are the correct thing are simply not working. Go back and take a look at the possibility of some allergic response. Okay, So that's something to keep in mind. Any symptom can be caused, almost any symptom can be caused by allergic response. And a lot of them are unexpected, and so they're missed by the doctors. Okay. All right. What works best with regards to your immune system? The liver, spleen, thymus, and adrenal glands are all very much involved with the immune system. They all have to be working well. Adrenals we're going to focus on here a little bit more in just a minute. It's so important. Toxicity can compromise the immune system, in which case we have to run the patient through a detoxification, sometimes more than one, if you're real toxic. We have a questionnaire on our website. It's a toxicity questionnaire. You can fill it out. Gives you a good idea of how toxic you are. You shouldn't have a score of more than 40 on that questionnaire. I've had a number of people that are over 100. We got a problem. Okay, and as we treat them, those symptoms go away. The body detoxes. One of the things we get a problem losing weight. One of the reasons is that the body will put fat on it in order to put the toxins into it, to get away from the internal organs. And you can't lose that weight until you get the toxins out, because the body doesn't want to release them to damage more sensitive and more important vital organs. So a detoxification will sometimes do what it takes for a person to start losing weight. That's one of the causes of weight gain, is that you're toxic. Now you can be toxic from your environment, things you breathe and eat and stuff like that, or drink. Or you could just not be getting rid of your own body waste like you should. It just doesn't happen. Medications will often have toxic things in them. They're toxic in and of themselves, because it's kind of a two-edged sword with the medication. That do some good things, but also generally causes other problems. Some medications, like immunizations, often are preserved with things like mercury, which is a heavy metal. It's toxic. So these kinds of things build up and accumulate in the system. The fillings in your teeth, the silver ones, can cause toxicity. Implants of any kind. You might have a pin, titanium pin from a fracture you had or something. You might have titanium implants in your teeth. These things can cause a problem. They bleed into the system, and so you become toxic. Okay? Some of them aren't too easy to remove. I've got a patient that we think she has a problem with the titanium pin in her. Well, it costs her a fortune to go and have that sucker removed. So we're not going to do that. We're just going to have to keep an ongoing detoxification, try to get her ahead of it, so that the body gets rid of the stuff as fast as it comes out. Okay? It's not practical sometimes. You can't sometimes go and get a big old pin in your leg that they have because you had a bad fracture. You're not going to go in there and say, "Oh, Mr. Surgeon, I want you to pull this out of me." No way. Okay? Or the screws really put into people. So sometimes you're just kind of stuck with it, and you have to make sure your body's efficient in throwing off these metal residues that need in the system. Okay? So that's some of the problems you'll have with that. Heavy metal load, again, like I said, we evaluate this often through hair analysis. It's pretty accurate, doesn't always show everything, but it's one of the methods we use to see if you do have a heavy metal load that can compromise your immune system pretty easily. All right? Regular and or high intake of refined sugar and other carbohydrates weakens the immune system. I think we talked about this in our last lecture, where if you take up a certain amount of grams of sugar, it actually shuts down the activity of the white cells for several hours. Okay, when people are taking sugar all day long, they're just knocking their immune system down. One of the best things you can do to try to avoid getting symptoms, we just don't eat a lot of sweet stuff. But what do? We're going into holiday season. So the winter's here, the bugs are more rampant, and we're plugging ourselves full of sugar, and the white cells can't function. You know why that works? The white cells have to have vitamin C to make them function. Sugar is made from sucrose and hydrochloric acid is how they make this stuff, or corn syrup is what they use. And they make it artificially. Now, it's similar chemically. So when you have a lot of sugar in your system, your blood's saturated with it, guess what's going to get into the white cell before the vitamin C does? Because you have a lot more glucose, a lot more sugar in your system than your vitamin C. Sugar goes into it, and the poor white cell just collapses, can't function, can't do its job. So that's why you get sick, because you're paralyzing your immune system with too much sugar intake. So stay away from it. Enjoy the holidays, but don't be crazy, okay?